Okay, hi everybody. I popped around and met everybody. Yeah, shh. No, I'm kidding. So I'm here today to talk to you about stroke prevention. Can everybody hear? How about that? Is that better? How about that? Is that better? I'm still yelling. I have the microphone and I'm still yelling. Why is that? So my name's Alixis Van Horn. I'm a nurse practitioner. My specialties are neurology and palliative care. So half my time I spend at Whittier Rehab doing a neuro day rehab program, which is stroke and brain injury rehabilitation. And the other half I work in a neurology practice and see patients in the community in nursing homes for palliative care. So I'm here today to talk to you about stroke prevention. I didn't bring slides, and my talk isn't too long because I wanted to leave room for questions and because I have clinic this afternoon, so I need to leave on time. But I'm hoping for an interactive talk despite the fact that you're chewing. I will be calling on you to participate because it's really boring to stand up here by myself the whole time. So let's start by reviewing what the risk factors for stroke are. There's two sets of risk factors for stroke. Things we can change and things we can't change. So the things we can't change are our gender. Well, of course, today that's debatable. But we can't change our biologic gender. And we can't change our age, much as we might like to. And we can't change our family history. What kinds of things do you think are risk factors for stroke that we can change? Diet. Low salt diet, absolutely. What else? You can maintain a healthy body weight. I'm still working on that. What else? Exercise. All good. How about smoking? Yeah, smoking. And blood pressure. Right? Blood pressure. And having had a stroke is actually a risk factor for stroke. Of the strokes that happen in the United States, a third of them are recurrent from someone who's already had a stroke. So stroke prevention applies to people who've already had a stroke as well as those who have never had a stroke. So while there are some things that we can't change, I want to talk about the things that we potentially can change. And so I have given you what I call my stroke cheat sheet, which is sort of your ideal numbers. I think looks like this. Yeah, y'all have one? Okay, so let's talk a little bit about blood pressure. Does anybody know what blood pressure measures? Thank you for that. Can we be a little more specific? What does the top number measure? It measures your heart at work. And the bottom number measures your heart at rest. So does everybody actually know what your blood pressure is? What we mean when we say, what is your blood pressure? You do? Do you want to explain it? Okay, so let me just give you a very brief analogy for blood pressure. If you picture a balloon, just a regular old latex balloon filled with water, okay, and it's closed at the end. If you put a garden hose, for instance, in the bottom of that balloon, and you squeeze the balloon, you're not going to have to squeeze very hard to get the water to come out into the garden hose, right? If you put a swizzle stick in the bottom of that balloon, and then you try to squeeze the water through, you're going to have to apply a significant amount more pressure, correct? Right, so that's what your blood pressure measures. It measures the work your heart has to do against the force of your vessel. If the balloon is your heart, and the garden hose or the swizzle stick is actually your vessel, your arteries or veins, what it measures is how hard the heart has to contract, how much force it has to apply in order to get the blood to flow through your vessels. The wider and looser your vessels are, the less pressure has to be applied. The narrower and tighter your vessels are, the more pressure has to be applied. So when we say we're measuring your blood pressure, what we're really measuring is the amount of force exerted against your heart. And it's measuring how hard your heart has to work. And that's why we want your blood pressure to be lower. So things that raise blood pressure, what are the things that raise blood pressure? A lot of salt in your diet. Why? Why? Why does sodium raise your blood pressure? Because water follows salt. If there's a lot of salt in your body, there'll be a lot of water in your vessels, and that's more pressure against which your heart has to pump. What else raises blood pressure?
Clogged arteries.
Huh? Clogged arteries. Exactly. Clogged arteries makes your blood pressure high because, again, they're narrow and they're tight. What about stress? Stress raises your blood pressure. Ever get red in the face when you're mad? Yeah, that's raised blood pressure. So, yeah, stress is definitely a culprit. Smoking raises your blood pressure because it causes vasospasm. It causes your vessels to clamp down, and that will raise your blood pressure in the short term. Let's see, stress, sodium. I think that's, and kidney disease. If you have kidney disease, sometimes you can have attendant hypertension or high blood pressure as a result of that. So let's take those things one at a time. So obviously, if you're smoking, we'd like you to reduce the amount of cigarettes you smoke or any other tobacco product or inhalant, whatever that might be. But in terms of your sodium, what's the average daily recommended amount of sodium? For a patient who's had a stroke, it's 1,300 milligrams, correct. Or someone who has a lot of risk factors like hypertension or coronary artery disease. But for the regular average adult, it's 2,200 to 2,500 milligrams, and that's generous. The average adult in the United States, how much sodium do you think we eat? Between 5 and 7,500 milligrams a day. That's a lot of work for your body to do, your kidneys and your heart to excrete. So are we ever going to be perfect? I can tell you from educating and counseling patients and from my own eating habits that it's nearly impossible to eat 1,300 milligrams of sodium a day every day unless you're not eating any processed food whatsoever. The more processed a food is, the farther it is from its original presentation, if you will, the more likely it is to have sodium. So things that are canned, you should rinse them because the sodium is actually in the water, not the vegetable or the fruit for that matter. So you want to rinse those things to get rid of the sodium. Things that are processed like frozen foods, boxed foods like macaroni and cheese and canned soup and cottage cheese, they have a ton of sodium. So just for the fun of it, I put some little papers around for a breakfast item and a lunch item. And of course, they're all from either common or fast food restaurant chains because that's where the most reliable nutrition information is available. Obviously, there are foods that you buy in the supermarket or make at home that I don't have accurate sodium recordings, but just to give you an idea, can you look at the back of your breakfast item and tell me how many milligrams of sodium, what you have, and how many milligrams of sodium you have on there? Just zero. What are you eating? But what is the item? Old-fashioned oatmeal. Sometimes old is best, right? Oh, no sodium at all. Somebody else? A pumpkin muffin. Oh, my favorite. From Panera, yeah. The root of all evil in my life, Panera. How many? 480. Almost 500 milligrams of sodium. So if you think you're supposed to eat 1,300, you just had half of your daily consumption, roughly, in that pumpkin muffin. Someone else? 180. What's your item? Cheerios. Simple is good, right? 180 milligrams. That's very, very reasonable. You could have a lot of Cheerios.
840.
Huh? Well, no, actually, Cheerios are pretty good. Well, what's the milligrams of fat?
29.
29 milligrams of fat? That doesn't sound right. I'll come look at that. All right, sorry, go ahead.
840.
840 milligrams of sodium. Okay, that's getting your day off to a good start. What's your item?
Dunkin' Donuts, bacon, egg, and cheese on a croissant.
Who likes that? Bacon, egg, and cheese on a croissant. My husband loves that. And every time he eats it, I'm just like, oh, no, I'm with you. Who else? 600.
Same thing, except on an English muffin.
Oh, so just by changing the croissant to the English muffin, you cut out 250 milligrams of sodium. What else? Does anybody else have one? I know you do because I gave them to you. No, we're on breakfast. Sorry. 740 milligrams in.
Meat lovers pizza once.
Oh, that's lunch. We're on breakfast. Yeah, we're on breakfast. What are you eating?
A Starbucks dark chocolate and caramelized banana oatmeal.
Oatmeal again. So the more you doctor, so that oatmeal had 0. As soon as you start adding all the stuff that makes it taste good, you start getting sodium. What about you guys in the back? Do you have any? In the back? Yeah, people behind you do. No? Nobody wants to volunteer? What do you got? I see you looking at me. What do you got? What's on your little piece of paper for breakfast?
I got sodium of 380 milligrams, and it's a something known as veggie egg white wrap.
Ah, so something healthy, right? Veggie egg white wrap, that's supposed to be healthy, right? Almost 400 milligrams of sodium in that puppy. Yeah, okay. Yeah, right? Exactly. So the message here is not that you can't eat sodium, but that you need to ingest it wisely. If you're going to have a really high sodium breakfast, don't eat pizza or Chinese food or Campbell's soup for lunch, because that also has a lot of sodium. So it's just sort of trying to keep an eye. So reading labels is your friend, right? Now let's look at the lunch items. Who's got a lunch item? Okay, so let's start with the pizza. 740 milligrams of pizza in a slice of Meat Lovers Pizza. So that's what, Pizza Hut? Yep. Pizza Hut Meat Lovers Pizza, 750 milligrams. One piece. I don't know anyone who's ever eaten one piece of Pizza Hut pizza. What else have you got? 1,400 milligrams. In what?
Mediterranean veggie sandwich.
A Mediterranean veggie sandwich. Mediterranean veggie, that's like the healthy option. 1,500 milligrams of sodium in that, right? Yeah. Who else has got one? Campbell's soup. New England clam chowder. 890 milligrams of sodium in that. And that's the recommended serving size, right? I don't know anybody who eats that either, because it's usually about half of what I eat. What else do you have? Campbell's soup. Is it the healthy choice? Oh. Creamy chicken and herb dumpling. 800 milligrams of sodium. You getting the picture here? Yeah. Can I borrow yours? Wow. Okay, so this is a Panera sandwich, turkey avocado BLT, 950 milligrams of sodium. So, it's all of it. All of it is processed. You know, it's all processed. The sauces, I thought I had a sauce. I did one sauce. So you know how when you go to Panera you get the you pick two, right? You get a salad and a soup, or you get a you pick two, so you can have like half a sandwich and a soup or a salad. The baguette, the piece of bread that comes on the side, has 500 milligrams of sodium in it. How bad's that? So Boston Market, macaroni and cheese, 1,050 milligrams. This is the barbecue ranch dressing at Wendy's, so they give you a little packet of the dressing that goes on your salads. So I think it's 2 tablespoons, 260 milligrams. So just stuff to be aware of. And in addition to sodium, which we want you to pay attention to, we also want you to watch your fat intake, because that contributes to a healthy weight and also to the clogging of your arteries. So on the backs of those, you'll also see that there are fat markings, and you will be surprised at the amount of fat that you consume in these foods. So what's the average recommended fat intake for an adult? It should be between 20 and 30% of your total calories. So if you're taking in like a 2,000 calorie diet, which is the average female adult, you're going to be taking in 40 to 50 milligrams of fat a day. So I just want to tell you a word about fats. The more liquid a fat is, the better it is for you. Okay? Do you know how they say that there's a saturated fat Saturated fat. So saturated fat, all fat is a long chain of carbon molecules. That's all it is, a long chain of carbons. And on each carbon is 4 hydrogens. Okay? If there are all the hydrogens on those carbon chains are saturated, are covered with hydrogens, if all the carbons are covered with hydrogens, then it's saturated. And the reason that it's bad for your body is that there's no break in the chain that allows your body to break it down. And so it tends to remain solid in the body and then get stored as fat, both in your subcutaneous fat and the fat right under your skin, but also around your organs and in your vascular system. If it's a polyunsaturated or an unsaturated fat, there's not a lot of hydrogens on that chain, and the body can break it down at a lot of different points and make it smaller, which means it can digest it. And so that's why polyunsaturated or unsaturated fats are better for you. Okay, so we've talked a little about fat, we've talked a little bit about salt. Ideal body weight. Anybody get their BMI calculated when they go to the doctor? Anybody been told that their BMI is too high? Have you heard that? So body measurement index, BMI, is a measurement of height versus weight. It's based on your height, your age, your bone structure. And we should fall between 19 and 27. That's the number you should be at, 19 to 27 on that chart. I think mine is like 33. My doctor is not happy with me. I'm not happy with me, but that's another story. So we want to try to reduce our ideal body weight because it's more weight for your skeleton to carry and more work for your heart to do. So we definitely want to do that. All right, what about stress? Everybody's friend. Can't get away from that. So can some folks just volunteer what they do to manage their stress? Does anybody have a stress management tool that they use regularly? You have a dog. Dogs are great stress relievers. And in addition, they help you to get out and exercise. Because if they don't exercise, they make you crazy by chewing on your things and digging in your garden and so on and so forth. At least mine do. What else? The grandkids. So spending time with people you love. That definitely helps. That's a good stress reducer, unless you don't get along, in which case it's worse. Okay, what else? What else? What about prayer? Does anybody use prayer as a stress reducer? When you're feeling anxious or worried about something, you can always use prayer. What about yoga? Anybody do yoga? So if you have a few hands, yoga, very good stress reducer, in addition to increasing your flexibility. How about meditation? Although prayer is kind of a form of meditation, right? Anybody do meditation? Or, yes, you do. Good. Or guided imagery? Any of that? No. Okay, spending time with a friend, going for a walk, reading. Those are all stress management tools in addition to the more formal ones like doing yoga or doing meditation. And I would encourage you to be aware of your stress level because it's important in preventing disease, including stroke. So stroke is the 5th leading cause of death and the 2nd leading cause of disability in adults over the age of 25. 5th leading cause of death. And I can tell you from all my years of working with stroke patients that there are some fates worse than death. For some people, trying to adapt to a disability that a stroke can cause is very, very profoundly painful for them, not just physically, but emotionally and spiritually. And if we can reduce that or avoid it altogether, that would be, I would like nothing more to be put out than to be put out of business in that regard, because it is very hard to help folks rehab from stroke. So we encourage people to practice healthy lifestyle, like not smoking and watching their diet, exercising daily. At least 30 minutes of gentle daily exercise is what the government's recommendation is. And that can be walking down to your mailbox 3 times. It can be going out to the garden. It can be walking your dog. It can be vacuuming. Just move for 30 minutes a day. And it doesn't have to be 30 consecutive minutes. It can be 6 5-minute cycles. It can be 3 9-minute cycles. It doesn't really matter as long as you move 30 minutes a day. Keep your joints lubed. Keep your flexibility and your balance. And then watching our diet and then taking in adequate hydration. That's a very good stroke prevention measure. And the other thing is controlling your blood pressure. So who here monitors their blood pressure at home? Anybody? Yeah. Do you find that the readings are relatively stable, meaning you have a sense of what's accurate? Yes? Yes? Okay. So measuring your blood pressure at home can be done a variety of ways. There are wrist measurements that you can apply yourself one-handed. So if you have a mobility issue with your arms, you can apply it with one hand. And they're pretty accurate as long as you pay attention to the positioning instructions. They don't work as well if you have your arm dependent. Your arm needs to be up like this, like you're saying the reverse Pledge of Allegiance, so that the recording device is near your heart. There are also the cuff manometers, either the old-fashioned ones that I learned on where you pump them up, and now there are also some electronic ones. And they are relatively accurate for the most part. You should bring it to your doctor's office just to make sure that what they get correlates to what you get, and if not, then how much off you are, so that you can sort of keep an eye based on what the doctor's recording is relative to what your recording is. So for instance, if when you go to the doctor, your measurement is 120 over 80 and his measurement is 135 over 85, then you know that yours is a little lower, or you have white coat syndrome, one or the other. But you want to measure consistently across time. So for instance, what happens if one day you take your blood pressure and it's 150 over 90? That's high for you, say. It's high for anybody. What do you do about that? So, right, exactly. You want to try to correlate it to what's going on. Are you feeling really stressed? Did you eat a lot of salt? Did you forget to take your medication? That happens sometimes. Did you run out of your prescription? What do you do, though? Right, sit down, relax, have a drink, and check again in a half an hour to an hour. 150 over 90 is not an emergent blood pressure. 160 over 100 is an emergent blood pressure and should get a call to the doctor, especially if you take blood pressure medication, so that you can have an adjustment. If your blood pressure is consistently over 160 over 100, either number, over 160 or over 100, so that could be 120 over 100 or it could be 160 over 80. Either way, if you're consistently over that, you are at marked risk for a hypertensive stroke, a stroke related to your high blood pressure, and you want to be seeking medical attention for that. What are the warning signs of a stroke?
Headache.
It's a good one. Headache. What else?
Lopsided face.
Yeah. Does anybody remember the acronym FACE from stroke? There's a poster that says FACE, and it's an acronym. It stands for face, arm, language, and eyesight. Did anybody recognize that? So typically, strokes happen mirror image. So if the stroke is on the right side of the brain, the left side of the face and body will be affected. And so you can get a droop in the face, slurring of the speech as a result of the droop, right, or the weakness. You can have problems producing language, either not being able to say what you want to say or saying something other than what you mean. Your arm will often tingle, feel heavy, go numb, or be weak. And the same for your leg, typically on the same side. And you often have a headache, especially if it's a hypertensive stroke, you'll have a headache. So what we try to teach people is that time is brain. There is medication that we can give for clot-related strokes called TPA. Have you heard of this, TPA? There's a 3-hour window from the onset of symptoms, which means if you sit with your headache at home and you don't feel quite right, but you're not sure, and then you go to the emergency room when your daughter gets home from work and can drive you, the window is shut. So we try to educate people to go to the emergency room to get screened if they're concerned at all the minute their symptoms start. The more you wait, the more likely you are to have profound damage. So it's better to go and get screened, let them do a head CT, check your blood pressure, do the neurologic exam, and rule you out than to stay home and suffer the ill effects of a stroke that could have been mitigated by the administration of TPA. They can't give TPA for hemorrhagic stroke, so if you have an aneurysm or an AVM, an arteriovenous malformation, or you have a trauma, you can't have TPA because it causes clot busting, and we don't want that. If you're bleeding, we don't want to prevent you from clotting. But if you have an embolic or a clot-related stroke, like from AFib, then we definitely can give you TPA if you get there in the window. So it's something to remember. Don't wait. It's like I said, it's better to go and be embarrassed than to stay home and be impaired. In addition, I'll just talk about AFib just quickly because AFib is a major risk factor for stroke. Anybody here have AFib? Take anticoagulants? I'm all set. Coumadin, Pradaxa, Eliquis, aspirin, any of those drugs? Yeah. So these drugs are anti-clotting drugs. They prevent your body from clotting, so of course you're at more risk for bleeding. Coumadin is reversible, meaning if you fall on the ice and hit your head and you have a bleed and you go to the hospital, the hospital can reverse the effect of the Coumadin to help with clotting. Pradaxa and Eliquis are not reversible. So you need, if you're on those drugs and you have a trauma to the head, you need to go to the emergency room immediately. And it's critically important that you take the medication as close to the same time every day as you can. And in the case of Coumadin, that you get your levels checked, whatever you and your doctor decide is the appropriate time frame. Because without that, your AFib almost certainly will lead to a stroke. We know that. We know what the natural history of that is. So even though going to Coumadin clinic is a tremendous pain in the you-know-what, it's a lifesaver, literally. So I think that's pretty much what I wanted to cover in the brief time that we have, but I'm glad to take a few questions if there are any questions. What if you're not paying attention? Well, I would hope that after you hit your head, you would realize that you hit your head. If you're on blood thinners and you hit your head, you can certainly go and be checked. If you have headache, dizziness, nausea, or trouble with thinking or speaking, you should go and get checked immediately. Yeah. And anything that causes you to lose consciousness needs to go to the emergency room. If you fall hard enough to black yourself out and you see stars and birds, you need to go to the emergency room. Anything else? Any other questions? No? Okay, well then I thank you very much for your attention.